look at is going to be the iliopsoas of the hip flexor. It's going to be a unilateral joint muscle, so we're not going to have to worry about bending the knee as well like we will for the rec fem. With our patient in the prone position, we want to make sure that we have a pillow underneath, as well as a little towel that's going to give us that shelf. Having the bed lower down will allow for you to be able to do almost like a kneeling position. You can palpate the PSIS on the posterior aspect of your patient, be able to use that to maintain that nice pelvic posture and not allow for your patient to compensate. So if you are having compensations, you're going to have your forearm right here placed directly across both PSIS, and you can apply a little bit of pressure. Now, I have a towel placed underneath of her knee to give me a shelf so that I'm able to be able to grasp her leg. Reaching into your patient's inner leg, you want to just make sure that you have their consent. Dr. Dickerson, is it okay if I reach inside of your leg to be able to hold your leg into position?
Yeah.
Okay, so that towel gives me just a nice little shelf there. So in this lunge position, I'm able to use my body to be able to come and elevate her leg into more of a hip extension position, because I'm just going to do exact opposite of what the muscle does, which is flex the hip. So I'm going to, bring her leg towards me, come up nice and easy and support it, and be able to hold her in that flex position for a passive stretch of 30 to 60 seconds. Now in this position, if I feel like I'm getting tired, I can use my leg to be able to support and not have to hold and do all the work with my arm. So again, a passive stretch is going to be 30 to 60 seconds. She's not compensating. Dr. Dickerson, do you feel a stretch?
Yeah.
Where do you feel a stretch?
In the front of my head.
And that's exactly where I would want it to be. So I don't have to modify or adjust. I can slowly come out of the stretch and then repeat it as much as I need to.